ting solar-powered thin client computing for public education. Ang punto, kung saan talaga walang kuryente, paano? So, that would be an interesting point. Again, as you go to your barangays, as you extend the CECs, that would be an e-society issue. So, what you want to do is in the new ICT office, which is under a rationalization plan right now, we want to pinpoint what are the specific digital inclusion measures that we want. So, and the last thing I will mention is, yun nga, kung ang tanong, Doc, ay ano ba pwedeng gawin ng ano? So, sinasabi ng telcos, 99% covered na daw nila ang Pilipinas. Hindi ko alam kung naniniwala tayo doon kasi nung eleksyon, noong 2010, hindi na ako makapag-transmit ang 35% ng ating probinsya, di ba? So therefore, posibleng may point of presence sila sa provincial level, pero sa barangay, napakalaki pa rin ang access gap. So, gusto ko lang parang pahapyawin that there is a new emerging technology that will allow us to use TV white spaces, yung mga sa gitna ng Channel 2, tsaka Channel 4, tsaka Channel 7 na hindi ginagamit, nale-leverage sa po yan for rural broadband. So, may technology there, the policy framework is being developed, and then nagtetest na po sa Pilipinas. And this is directly what I'm challenging sa CECs. Sa mga areas na kung saan nandun tayo, sa sentro, dahil doon may connectivity pero kung leverage natin yung super Wi-Fi, it's a more powerful Wi-Fi using TV white spaces. Access provider na rin po pwede. Magiging community network kayo. Community network provider. For me, that's a value add. Because kung saan yung 35% na hindi nakapag-transmit ng eleksyon, doon natin kakabitan ng base station ang super Wi-Fi. So briefly, ganun yung takbo nun. So e-society is inclusion. E-society is everybody, walang naiiwan.
Okay, so no person left behind, basically. And I guess the challenge here is that para ma-fulfill natin yun, no, talagang malaki magiging role, malaki nakikitang role ng ICTO na nakikita sa mga CECs to fulfill that mandate na talagang dapat lahat ma-reach, no, by hook or by crook, no? So this is a good challenge. So you touched about Al, you touched about content, no? So also one of the challenges that you are throwing with our community centers, no? So actually, PhilSecNet has piloted what we call community-based content development, no? And for example, we've touched on creating content with the help of our CECs on topics such as health, such as education, agriculture, and livelihood. Because we feel that at least sa content, there's a lot of opportunity with your CECs, no? So actually, there will be four community centers that we will be parang certifying as centers of excellence in content development, no? But I touched on areas such as education, health, livelihood, entrepreneurship, no? So I guess our next four speakers, I'd like to get your opinions on this, no? So if I can ask Irma, no? On the area of health, no? Ano ba ang mga possibilities, no? Because Irma has been working with developing what we call mobile health solutions, no? That are really very talaga na-i-implement siya at the public health level. And I guess public health and the provision of good health is a concern, no, for many of our municipalities and also of our mayors, no? And we also really want to leverage our CECs, no, to be also hubs for development of health content, sharing of health information, and Irma, no, has done a pilot project on this in a municipality in Mindoro Oriental, no? So maybe if you can share, quickly share with us your experience in that. And maybe, halimbawa, itong paggagamit ng mga cellphone, pagtitrain ng ating, for example, ng mga rural health workers, no? Paano ba natin ito pwedeng ma-scale up siguro sa ibang municipalities? And then paano to sa palagay mo paano to mas magiging mas priority ng mga community centers?
Okay, so before siguro sasagutin ko kung paano ipa-prioritize. Malaki talaga ang role ng CEC natin, particularly influencing our local government officials and the local chief executives. On the places that I've been through, tinatanong ko kung sa implementation ng e-governance, ang pinakauna-unang kino-computerize ng local government is the budget, financing, statistics, and so on. And then pag ang pinakahuling nakaka-receive ng ICT grants or assistance ng paggamit ng computer is the healthcare. Agree ba kayo doon? Sino nga pakitaas ng kamay? Kung sino sa inyo ang healthcare, sa healthcare ninyo sa RHU ang hindi pa nagkaroon ng computers?
Okay, sino dito ang may municipalities na hindi pa computerized yung inyong RHU?
Pakitaas po ng kamay.
Meron bang ganon? Oy, marami ng computerized.
Marami ng computers? Okay. Sa mga hindi pa po naka-computerize, kasi ang sagot nila sa akin, ma'am, kaya po naman, ang pinakalas po ay ang mga health people na makareceive ng computer. Kasi po, palagi naman po sila sa field at hindi naman po nila ginagamit yung computer, only gagamitin lang nila maglalaro. At saka isa pa po, matatanda na po yung mga midwives at hindi na po nila kailangan ng training. So yun po yung lagi nilang sinasagot sa amin. So kung yun po yung pananaw ng ating CEC, how much more yung feeling ng mga midwives na takot sila sa technology. Where in fact, our healthcare system uses or utilizes and gathers the most number of data sa ating mga community. So considering na they've been carrying lots of booklets now when they go to the barangays, just mere fact na thinking, pwede kaya natin itong i-computerize so that instead na mag-iisip sila magsusulat sa papel, why not put it in a computer so that it will be systematically arranged, systematically gathered, so that when they do decision makings, it would be easier for them to see or to decide which health priority are they going to address. So isa po yun sa magiging role po ng ating CEC na pakitulungan namang assess ng capacity ng ating rural health unit at makita yung need or pangangailangan ng computerization din ng ating mga health workers. Pangalawa po, kung ano po ba yung pwede pa nating maitulong, kasi yung isa naming experience is that with the Rojas municipality, we asked them to train our midwives, nurses, and doctors on the use of computer. And also, because we provided them computers at the rural health level, they also extend their assistance on troubleshooting sa hardware because we have technicians in the CECs.